Good evening, everyone. It is May 12, 2025. Apparently, it's 7:01 here in the Aldermanic Chamber. This meeting has been duly noticed in two places, including the city's website, in accordance with the requirements of RSA 91A-2. Let's start the meeting by taking a roll call attendance.
Alderman Chris Thibodeau. Alderman Tim Senate is here. Alderwoman at Large Gloria Timmons.
Here.
Alderwoman at Large Shoshana Kelly, Vice Chair.
I'm here.
And Alderman Tom Lopez, Chair.
I've been here.
We have 4 in attendance. Also joining us this evening is Mike Jungers, Urban Programs Manager, and Matt Sullivan, Community Development Director.
As well as a number of
I also see
community
Director
leaders.
Bagley from Public Health. Who else can I not see back there? Director Liz Hannum. Thank you. I'm adjusting. All yours.
All right. So first, we have public comment. Any one member of the public wishing to make public comment, please come up. Remember to give your name and your address for the record. Director Sullivan, please proceed.
Thank you, Mr. Chair. Matt Sullivan, Community Development Division Director. I assume you do not need my address for the matter of record, but it is 229 Main Street here in Nashua, New Hampshire. I just wanted to quickly address the fact that last week, as part of the budget review process for the Community Development Division, I, in fact, ended up discussing the CDBG request that's in front of you this evening for $40,000 for participatory budgeting in the Crown Hill neighborhood. As a result of that discussion, I did not request presentation time this evening, so I won't be speaking to you later during the agenda so that the agencies and other city departments have more time this evening. But naturally, if questions do arise related to that specific request, I'll be in the audience. I'll be available to answer those questions, recognizing that I'm not on the presentation agenda. With that, Mr. Chair, I'm happy to answer questions later in the meeting, and thank you for your time this evening.
Okay. Any other members of the public wishing to make public comment? Okay. Next up, communications.
The communication has been received from Mike Jungers, Urban Programs Manager, regarding fiscal year 2026 HUD CDBG application summary.
There being no objection, I will accept the communication and place it on file.
I believe Director Sullivan wanted to come forward on that.
Director Sullivan, would you like to make further comment?
Or introductions.
Good evening. For the record, Matt Sullivan, Community Development Director. This is actually an item that sort of bridges between the communication and the item on your agenda tonight, and that is the presentations. But I wanted to just quickly take a moment this evening to introduce the new Urban Programs Manager to the committee. That's Mike Jungers, right back here, and he'll introduce himself in just a few minutes when we kick off the presentations. By way of quick introduction, and certainly I'll allow him to say a few words as well, Mike has been with the division in urban programs for about 4 years now, if I'm not mistaken, almost 4 years, serving primarily on the project delivery, or really the project management side of things. And over the last year, actually moved into a hybrid role, assisting the Community Development Division, myself, and some other project management tasks that have arisen. I'm extremely excited about having Mike step into the new role, particularly because of over the fact that the last year, Mike has been an incredible asset, ensuring that the CDBG work, the homework, and the rest of the Urban Programs Department's work has continued in spite of several staff transition challenges. And so Mike's been a critical piece of that. He's going to fit very well in this new position, and I'm very excited to be able to present him to you this evening. Mike will be assisting through the presentation process to the extent there are questions related to the process. He'll also be assisting you quite a bit at your next meeting when we go through the scoring process. Mike is going to help me facilitate that process, going through the spreadsheet and all of the dynamic scoring that we do that can be a little bit of a challenge. But with that, I'll stop for now. And Mr. Chair, once you get into the presentations, I would ask that perhaps you allow Mike a second to not only introduce himself, but to also introduce a member of his team, Nicole Jameson, and talk a little bit about her. But for now, I'll cede the floor. Thank you.
Actually, Director Sullivan, I would just an offer. If you and Mike would like to sit, because we likely will be asking you questions.
Certainly.
It would avoid the whole aerobics of getting up and sitting down and getting up and sitting down.
Happy to. Mr. Chair, would you like that during the presentations? Is that acceptable?
Yeah, I just have a seat in the horseshoe, and then
Sure.
as organizations come up, they can present.
May I ask Nicole to join us as well?
Sure. Yeah.
Thank you.
We have plenty of seats.
Appreciate it.
All right. Discussions, presentations.
First up for presentations, we have Family Promise of Southern New Hampshire.
Let's give everybody a second to come migrate. Welcome,
You can come
presenters.
up and
Remember,
have a
use
picture.
your name and at least organization, just so the transcribers can tell the difference.
Okay. Hi, I'm Joanne Perez, Family Promise of Southern New Hampshire, Diversion Prevention Director.
Hi, I'm Karen Burnish, Director of Grants Management, Family Promise of Southern New Hampshire.
Hi, we are here today, I was going to say this morning, geez Louise, this evening, Family Promise of Southern New Hampshire. We are a 3-program facility in Greater Nashua, and we do have other, I'm sorry, I'm dry right now. We have 3 other programs. We have our transitional housing program, which will house up to 24 families, whether single dads, single moms, intact families, aunts, kids, grandparents' kids. We also have our supportive housing program, which we have 4 units, 4 units right now, where we sublet from the First Church, and then we lease out to below market value. We do inspections and case management, financial literacy, things like that. And then the prevention diversion program, which I lead right now. We play a major role in assisting clients with preventing evictions, utility shutoffs, car repairs, motel assistance, driver's license renewals, anything to keep somebody from being evicted or preventing them from entering shelter. We do try to do that. 2024, the whole year, the diversion prevention program assisted 954 people, along with working with our partner agencies, the city welfare and other front door, other agencies in the town. Right now, from January to April, I have already assisted 365 people, of which 143 was preventing families from being evicted, families and single adults. Been certified with HMIS, so I can put in make sure that our if HMIS, is everybody familiar with
Homeless Management
HMIS?
Information System?
Yes, okay. So I am familiar with putting the information that's proper in there to guide people to the resources that they need to be guided to.
So we don't want to undersell that for members who aren't as familiar, because getting interagency cooperation is key, and getting real data on who's homeless, what the population trends are, is very, very valuable, but it's also very difficult to do all the work you're doing and then also all the data entry, so we
Yeah.
appreciate it.
Yeah, thank you, thank you. It's a very good lesson, very opens my eyes, but it's great to also be working with other resources to make sure families are, not sleeping in their cars. And if they are, it's we try to avoid that. As far as numbers go, I mean, again, it speaks for itself. Last year was 954, and I'm already at 365. So I'm getting about 70 to 80 calls per week. And 80% of them are returned without leaving voicemail, because they're just calling me for this purpose. So working with the FAN, the Financial Assistance Network, that is done on a monthly basis, and that is a Zoom call with different agencies. We have Corpus Christi that I do work with hand in hand. Susan and I work with the prevention program. City Welfare, Bob, Mike Giamachetti. The Front Door Agency is also on there, as well as St. Patrick's Church and any other financial assistance agency. I think that's it. Do you have anything else? No. Do you have any questions? Anybody?
Just a point of clarification, Director Sullivan. I thought we had a CDBG project for, I think it was First Church, and then you had said that had been discontinued. Was that theoretically in addition to this, or?
Yes, I'm happy to answer the question. That project was funded at an amount of $100,000 approximately 2 years ago. Ultimately, the project was unable to secure additional capital funding necessary to complete it. And in the interest of timeliness requirements from HUD, we ultimately rescinded that award. Obviously, the project was an excellent project, scored well in our internal review processes, but again, based on the need to redeploy the money into other projects, we did rescind the request. But I think we'd be happy to consider such a request moving forward, subject to fund availability.
Okay. As I recall, you were also instrumental in helping with the stepping stones when that organization dissolved, helping
Yeah.
house and relocate.
Yeah, we did a lot of work with the youth. Family Promise pretty much took care of making sure that these youth were placed, whether it's in an apartment, jobs, and they're all right now. We still keep in contact with them. I have assisted one with doing some budgeting, case management. They're always welcome to come. They give us a call all the time. They call Pam, to say thank you, but we were a big step in that.
That was clutch. I can't imagine anything worse than you're a homeless teenager, you've already struggled with all of the family dynamics that put you there, you've tried to finally ask for help and take your steps forward, and then the organization just, stumbles around you.
Yeah.
You guys being there to reach back was key, not only for everybody that was involved, but also the city, because we were kind of taken aback that this all happened so
Yeah.
quickly. We didn't know what could be done or who could do it, but you guys did, and you did it. So we
Yeah.
appreciate that.
Yeah, thank you. Thank you, I appreciate that, the recognition for that.
Alderman Timmons?
Oh, thank you, Chairman. I have two questions, if you may.
Sure.
One is, you said between January to April, you have 365 new applicants. Is that an uptick from last year this time?
Yes, and it's not necessarily just applicants. It's my phone calls are, if you're not eligible for our program, because I do the initial intakes for Family Promise Transitional Housing. I'm giving you resources. You need to come in for budgeting, let's do budgeting. You need to apply for Medicaid, come on in, I'm gonna help you get on New Hampshire Easy. You need to do unemployment, let's do it. It's resources as well as just the intake for Family Promise Transitional Housing Program. It's also, getting help with the rental assistance, contacting the landlords, trying to work it out so we're not going to court, jacking up those fees that the clients have.
May I?
Yep.
Just a follow-up on that question. So from 2024 till now, would you say there's a 10%, 20% increase? Just trying to
Right
wrap
now, it was, last year, I did my numbers today, that's why. So last year at this time, January, February, March, it's not including April, was at 220. So we're definitely up.
Yes.
Definitely up, and it's just getting harder with the pricing of housing. So it's life right now, so people are just having a hard time keeping up. So it's a lot more needed, and we're just trying not to get somebody homeless. So we just do our best because once you're homeless, it's so hard. It's so hard.
And it's not cost-effective either for the city or for anybody else.
No.
If we can prevent homelessness, it's always a better situation. And as you're illustrating, that's an increase of about a third.
Yeah. Yeah, it's busy. We're busy.
And yes, and there's one other question.
Sure.
Have you applied for any funds over at the casinos, such as Nash Casino? Are you on that list?
I believe we are. I'm not gonna answer that one because I will let either Pam or Karen answer that. They're the money people, so, but I believe we are, right?
Yes, we are.
Okay.
Any other committee members with questions or comments?
If you need specifics, Pam can answer anything, but we do receive funding from the casinos. We are on that list.
Oh, good.
The Gate City.
Gate City Casino?
So this is just a follow-up on the casino. So do you have a date to go over there, or you already been?
See, I knew she knew.
Yeah. She's our backup band.
Sorry to arrive late. Thank you for seeing us this evening. I'm Pam Wellman, Executive Director for Family Promise. We are awaiting a date at Gate City Casino. We have not applied to the Nash. Because with the laws, you can only have 10 days as a nonprofit, so we've worked with Gate City for years, so that's where we've decided to stay. They offered it to us, so we're just waiting for those dates.
Okay, that's good.
Sounds like Alderman Timmons is planning a trip, so make sure we're aware.
I just want to make sure that they get everything they need, because I really
Yep.
appreciate all the work that you guys do,
Thank
and I
you.
know you need the money.
Thank you so much.
And I know where the money is at, it's over there. So, to not apply for that kind of grant
too.
is crazy.
Me
So,
too.
thank you for everything that you guys do.
Thank you so
much.
much.
Thank you.
And we have to say too, if you don't mind, none of us are good enough alone. We all have our piece of the pie, and we all count on each other, and we work so collaboratively with the city. Just incredible people, and the Front Door Agency, Marguerite's Place, and Soup Kitchen, we're all together, and we
Yeah.
all do our work together. We count on each other.
That's why I love Nashua.
I know, it's so unique. It's so unique, and I'm the greatest
Yes,
cheerleader for
yeah.
that collaboration, aren't I? I'm always saying, I just love it about us here.
Thank you.
All right, well, keep up the good work.
Thank you.
Seeing no further questions, I guess we'll move on to our next presenter.
Next up
Alderman
is...
Sullivan, or Director Sullivan?
Just a quick, it's not related to Family Promise, but I wonder, Mr. Chair, if before the next presentation, whether we might give Mike just a minute to overview the communication that was included in your agenda. It's a summary of the applications, and I think it's a particularly helpful one because it includes the funding amounts. So if acceptable to you, perhaps Mike could have a few minutes to overview that communication, how you might use it throughout tonight's meeting, if
Yep.
acceptable.
If you guys want to make yourselves comfortable, then
Thank you.
we'll let him do his
Thanks.
presentation. Thanks for coming up. Mr. Junkin?
Good evening, Chairman Lopez and members of the committee. I won't take long. Yes, in this summary, we just closed out our standard application process. And in the development of that, we have to keep in mind a couple hard and fast HUD rules as far as allocations. Primarily, HUD caps us at 15% of their grant allocation for public services. So as you may have seen in the communication, we have more requests for public service funding than we do public service funds that will be available. Please bear in mind that the HUD entitlement award that's listed is a somewhat conservative estimate, slightly below level funding for last year, so we are hoping to be surprised slightly pleasantly. But at a 15% percentage, it's not going to raise that public service number appreciably. If I could also draw your attention to the public facilities request on the, well, on my paper, it's on the backside. And we have requests for funding that is slightly less than what we're anticipating having available for public facilities. So one thing to keep in mind, please, as presenters are going through their information, is included in the packets is funding of some resources, and there are a few of these applicants that would face pretty severe challenges if they were to be funded at something less than what the request is. Some of these, just by the nature of the work to be done, are kind of go, no-go types of decisions. So if that information is available, I'm happy to offer kind of a technical opinion on that, should that come up during the course of the presentations.
Okay, makes sense. Any questions from committee members? Alderman Kelly?
Thank you and welcome.
Yes.
Well, again, I guess.
Thank you.
I do want to, so generally we have asked everyone who's come to apply what they would do if they got a partial funding. That's
Yes.
generally been the way we've gone about it. You said you have an opinion on that, or shall we still ask the applicants?
Please feel free to ask the applicant. I have a technical opinion based upon how HUD require or suggests that we evaluate the applications. I'm not sure in the, this is a dense pack of paper, but there is a scoring sheet that reflects that item as well as some of the others. So I'm sorry, ma'am, did I answer your question?
You pretty much did.
Okay, thank you.
I'm going to make a second request, but I want to make sure we're done with the administrative issue. Yeah? We good? You're all set. Then I would ask that Family Promise come back and answer those questions for us. So generally, we ask everybody, what would a partial funding look like? Do you have any other access to funds that could help with this project? Would you be able to go forward with partial funding?
Yep, I would definitely invite you to come back and make those specific references.
Karen Burnish, Family Promise of Southern New Hampshire. Could you please repeat the question?
Yep, so, could you potentially do partial funding? And if there are additional funds that might be available if we weren't to fund it at all or at a partial amount? So those two questions.
We do apply for a lot of grants, and we do diversify in our funding. Unfortunately, the landscape is very rough out there right now as far as funding is concerned. I'm sure you're well aware of that. So the amount that we are asking for is partial funding of the whole project.
Okay.
So it probably would be very difficult but obviously we would be happy with anything. So, did you want to add anything?
Family Promise does not receive any state or federal funding. We raise all of our own funds privately. Just over a third of our funding does come from grant applications, a third from our major donors and investors, and a little bit less than a third for our special events and event marketing. So we do count on any of our applications and our private funders or municipal funding to be able to carry out our programs.
Great, thank you.
Thank you.
Thank you.
Thanks.
All right, are we ready for the next presenter?
I believe so. Next up is Lamprey Healthcare.
Good evening, everyone. My name is Greg White. I'm one of the co-CEOs at Lamprey Healthcare, and I do have a presentation for you up above. I don't know if
The
somebody's
clicker's actually right there on the podium for you.
right.
If you just
Can I
point it
point
right here.
And maybe lean a little bit too.
It's very temperamental.
Maybe up a little, is this.
What
thing.
am I shooting? Am I shooting at the clock or the? Oh, there we go.
You're so good at
That
that,
one.
Director.
Gotcha. All right, thank you. So once again, my name is Greg White. I'm the co-CEO of Lamprey Healthcare. Lamprey Healthcare is a federally qualified health center operating in Newmarket, Raymond, and over here on 22 Prospect Street in Nashua. We've been around for about 50 years, about 25 in Nashua. Our world exists to provide primary care and adjuncts to that. So we have behavioral health services, we have substance use treatment, we have prenatal, pediatrics, and the like. We're also able to leverage services that support free and reduced cost breast and cervical cancer screening, family planning, hepatitis C treatment, and early childhood development. So our request before you this evening relates to services to our homeless and unstably housed clients. We do that in two ways, one being a mobile health unit that we deploy throughout the city and the region. Our mobile health unit actually visits the Greater Nashua Mental Health Center location on Amherst Street, as well as the Nashua Soup Kitchen and Shelter on Quincy Street. So we do that. We deploy a team of a nurse practitioner, a registered nurse, and a community health worker. So this is our folks visiting the Greater Nashua Mental Health Center. I suppose I can advance that. This is actually Maddie, our community health worker, who's at the Quincy Street location of Nashua Soup Kitchen. So one other way that we serve these folks is we actually have a more permanent location in the Nashua Soup Kitchen at Spring Street, so in their shelter building. We actually have built out an exam room, and again, we staff that with a nurse practitioner. This is Ling, a community health worker, and a registered nurse. The registered nurse has additional certification in addiction and recovery, as well as being a certified diabetes educator. It's our mission to provide services and care to everyone that need it without regard to an individual's ability to pay. So our reason for submission to you this evening is to help us fund this operation. As you would imagine, many of our clients have no insurance or have limited resources. And the model of care that we deliver in the shelter and in the van is much more intensive in time consuming. It takes more time to serve individuals who lack resources, that don't have paperwork, that may have not seen healthcare in quite some time, than it would be in the office, so that our billing of Medicaid, of insurance, is not adequate to cover the costs of those services. We do support this activity with a small grant from AmeriHealth Caritas, which is one of the Medicaid managed care organizations in the state, and have used opioid abatement funds in the past to help subsidize this operation. So, thank you for the opportunity to speak with you this evening. I'd be happy to answer questions.
Do you have a partnership with other organizations too? I think I remember at one point there was a partnership with Greater National Mental Health. Was it the Integrate program, I think?
Yes, it is. We do still maintain that in their building over on Prospect Street. We do quite a bit of work with the Greater National Mental Health Center. We're partners with the Greater National Dental Connection. They actually come in our building and serve common patients. Actually, we were, until recently, visiting Family Promise. Things were not as busy there, so we moved to another location, and actually had been on site with the Stepping Stones entity as well before their closure.
Do you partner with like Hearts or the Rescue Mission or? any of those
We
programs?
do a little bit of work with Hearts and Revive, a little less so with the Rescue Mission, but I'm sure we have common clients.
And there's, in addition to the office-based location, there is a mobile health center?
Yes, we have a mobile unit, the van that I was speaking about. We do visit right now 2 locations in Nashua, a location in Milford, and a location in Exeter.
Mhm. Okay. Do you want to ask your questions?
Sure.
Hey, their character, I mean, you came up with them, so.
Oh, my questions.
We're
Yes.
calling them the
Well, I
Kelly
had
questions.
some additional questions, but I was trying to put my fingers on the applications. Would this be an expansion of your current mobile, or just keeping it at status quo?
This is existing. This is status quo.
And is that because there is some funding pitfalls or concerns?
I would say, generally speaking, this funding is tenuous for this activity anyway, simply because of the level of uninsured that we serve. And to your earlier question about what would happen if we did not get full funding, we're able, at least to this point, to backfill the deficit of that program with resources from what's called the 340B drug program. As a covered entity for that endeavor, we're able to use those resources. The challenge is that's getting more difficult in terms of generating savings from that program as the manufacturers are pulling back on it. So.
Okay. Okay.
Have there been changes or concern to Medicare and Medicaid, how they're approached, that are directly going to affect reimbursement for this?
Medicaid in particular is of concern. Of late, I understand that while there was slated to be a 3% reduction in Medicaid rates to providers, that may have been put back in the budget with the Senate. More concerning right now is the federal level and what may happen to Medicaid there, and that is kind of hard to predict as to how impactful that will be, though they're talking some very large numbers in Washington.
How nimble is your organization? Just pointing out that we get this allocation from HUD once a year, and most organizations try to plan on a yearly basis, but that doesn't mean someone won't decide, a month from now that they're going to upend the whole thing.
So I would say we're fairly nimble and can make changes as need be. Obviously, we've had a history that's been challenging where resources weren't there, so that kind of takes some of your options off the table. Our biggest challenge, I think most everybody these days, is staffing, to have adequate staffing to deliver the care. So I think we can make changes as need be.
How many people does Lamprey as an organization employ in general?
210.
What's the percentage of those that are medical professionals?
We have about 40 that are providers or billable providers, like a doctor or an advanced practice practitioner. The vast majority are clinical staff, so that would be nurses and medical assistants, and then the folks that work at the front desk. We do house what's called the AHEC program, Southern New Hampshire Area Health Education Center. There's about a half a dozen there. Seacoast Public Health Network, there's 2 or 3, and the rest are, I would say, billing, finance, administration.
Okay. Alderman Timmons?
Thank you, Chairman Lopez. Thank you for everything that you do as well.
Thank you.
I know a lot about Lamprey, but one of the things I'm concerned is that a lot of the nonprofits and a lot of places where a lot of seniors are located, such as the senior center. And this past week, matter of fact, I think it was, I like to say Thursday or Friday, this past Thursday or Friday, we met at Soul Sisters of Seniors did. And it was talking about the care that they needed, and there was a lot of the nonprofits that was there at the seniors to help them out. I feel that Lamprey does not really follow up with seniors. Can you tell me a little bit about that and why not?
Well, I think we do have a fair amount of folks that are insured by Medicare, though I would say the demographics of our operation in Nashua, the folks tend to be a little younger than they do in Raymond and Newmarket, at least as far as our clinic goes. I think our Medicare population is fairly small in Nashua, which is probably why we don't have as much of a presence there. There used to be kind of a perception that once you had Medicare, you didn't need to come to us anymore. I would counter that to say we're open to everybody. So
How long
I'd
has
certainly-
Lamprey been operating in Nashua?
Since 2000. We took over the operations of another organization at that time. We built our facility that we're in now in 2011.
It's worth pointing out, I think, that older seniors might be used to other providers that might have been operating a little bit longer.
Yes.
20 years is nothing to sniff at, but a lot of the major healthcare providers are 40, 100, like very old. So
that-
it may
that-
just be a name. And I think you're also located on Prospect Street, but farther down, right? You have to literally go past a hospital in both
Yes.
directions to get to you?
Yes, exactly. And actually, that's the case exactly in our Newmarket Raymond sites. We've been around longer, and our patients have aged with us, which is why we serve so many more over there. So,
Well, Alderman Timmons just gave you a hot tip. If you park outside Soul Sisters when they're doing the Meals on Wheels.
I'm on it.
Yep. Any questions, Alderman Tennant? Alderman
No,
Timmons, you're set?
No, I'm sorry.
Okay, thank you for your presentation.
Thank you so much. Have a good evening.
Okay, next up is Nashua Police Athletic League.
Hello, I am Jen Miller, the Nashua PALS Director of Development and Partnerships. Thank you all for your time this evening. Nashua PAL has two applications. One of them is for public service and the other is public facility. The public service portion of our application is requesting support to offset for the long-term lease that we have at St. Pat's Gym. Between the programs of the Youth Safe Haven and St. Pat's Gym, which live under the same budget, by the way. We serve about 300 youth in Greater Nashua. Nashua PAL as a whole serves about 2,000 kids in Greater Nashua in education, activity, and leadership programs. Of the 300 youth for these programs, there are approximately 99% that are considered low income, with 94% of those being either very low or extremely low income individuals. 79% of our youth served in those programs are minority population, and about 80% of them come from Nashua's tree streets. Bless you.
Sorry.
So it is a vulnerable population that's served by these two programs. At the Youth Safe Haven, we provide free after-school and summer care for youth. That includes homework help, experiential learning, field trips, mentoring, and community service programs. And then in our St. Pat's Gymnasium, we've had a long-term lease there since 2012. And it provides indoor activity space for youth programs, as well as our Gate City Thunder basketball team and many other community partners. And since 2024, the attendance at the Youth Safe Haven and the St. Pat's Gym has continued to rise pretty steadily. In the first quarter of this year, we did notice about 28% more new youth members than last year in comparison. And we also took on the juvenile court diversion program from Youth Council when they closed down last year. So this budget offset would be a major assistance for us for the St. Pat's Gym, so that we could continue to enhance our programs. That is our public service program. Do you want me to wait and see what questions you have there, or go ahead and wrap into the next part?
I don't think we divided these, did we? Separate use it every time. Director Sullivan, we didn't separate these by the types they were asking, right? The presentations?
No, we just kept the presenters, even if they would have a public service or a public facility, to allow them to just kind of speak without having to repeat their organizational information.
Okay, so I would probably just describe both.
So for the public facility portion, Nashua PAL is requesting essentially, it's going to be 4 safety and security focused projects, upgrades at the PAL Youth Safe Haven building. And that the Youth Safe Haven itself, just to break it out separately, there's about more than 300 youth between the 2 programs. The Youth Safe Haven itself is closer to 275 youth. So we have 4 projects that we're requesting to have completed. One is the installation, or excuse me, 2 of them fall under installation of security devices. One of them is replacing an outdated router and firewall to help safeguard our youth and family records. And the second portion of that is the installation of indoor-outdoor intercom system to communicate better during some emergencies, and also better secure the building for youth pickup. That is something that has become a much more urgent need. We've had some neighborhood concerns and violence happening as of recently, so that's become a priority for us. And we also have 2 fire safety projects, and one of them is replacing the door in the lobby with a fire door. That was noted on our fire inspection recently that we didn't know. And they have informed us that we won't pass without that upgrade. And then also installing sprinklers under our boxing ring on the 2nd floor so that there's full coverage.
Mayor?
Alderman Timmons?
I thank you. Again, another great program. And Darlington Street Community Center has a lot of vandalism. The kids, kids destroy. So I was wondering, do you have that issue over there?
Not within the courtyard of the Youth Safe Haven at this time, thankfully. We always say that it's nice the neighborhood tends to keep all the other stuff on the outside of the fence, which is very much appreciated. But it's definitely a concern in the neighborhood. So we try and keep up with the garden giant down on the rail trail and pieces like that.
Okay.
Alderman Kelly?
Can you speak to, on the gym rental side, if you have additional funding, if we weren't to fund it, and, if you could take partial funding?
Sure.
Those are my 2 questions. I keep forgetting them.
Is Father Kerber going to kick you out?
So much like everyone here, our landscape for funding is changing dramatically often. And so we do have funding for the additional portion of that money. We do rent out the gym for some revenue to Nashua PAL, so that is helpful. But this definitely would impact us if we did not get full funding for it.
Alderman Senate?
Thank you, Mr. Chairman. I had a question just about the total activity project cost. The total, it wouldn't even be made up of everything that's listed here, 1,054, 742. How long of a lease agreement is that you have with St. Pat's?
So that's a good question. I believe it's a 3-year lease, but I can check on that and let you know. But it is a long-term lease that we've had since 2012. And Nashua PAL has made many improvements to the building itself, so it is provided valuable for St. Pat's as well.
All right, thank you.
We've done a lot of upgrading of our schools in terms of security vestibules and all that kind of stuff. I'm familiar with the layout of the Ash Street Youth Safe Haven site and making sure that it is a safe haven, for example, during some of the shooting incidents that have been happening over the last year. That seems to be what the intercom is about. Have you had any kind of a security assessment done of, how would you respond to a crisis? How do you do it? I know the police are obviously present, so have they done a formal assessment and made recommendations?
Yes. So last month, the entire staff went under, I'm not going to remember the right acronym, it was through the Nashua Police Department, it was crisis training. So they did a full day training with us to do the full assessment of or full instruction on what we do in case of an emergency, everything down to, packing bullet wounds if necessary. And then we have a second portion of that that's going to come up in the next couple of weeks, where they're going to come on site to Nashua Pals building and give us the full assessment on, if this situation were to occur, where to take the youth versus, gas leak versus intruder is different. So that full assessment on it.
Okay. So that project is just for intercoms, doors, and then sprinklers and a router?
Yes, correct.
I mean, I'm not going to undersell the router, considering we had a struggle last year with our school district suddenly having its information exposed, so that is very important, and I think it's progressive of PAL to be cognizant of that.
And they have informed us that apparently our current router after this year will no longer be supported by technology or tech support people, so.
Okay. Any further questions? Thank you for your presentation. We appreciate it.
Thank you so much.
And thank you for all your work in the community. I appreciate it. I appreciate having kids there and knowing where they belong and being cared for right in our neighborhoods the way that you guys are able to do.
Okay, next up is Nashua Children's Home. Excuse me.
Good evening. My name is Matt Ventros. I'm the Executive Director of Nashua Children's Home. I want to give you a little background on Nashua Children's Home. We've been in the area since 1903 with a variety of services. Currently, we have 3 different programs. Our first program is our residential program, providing residential services for at-risk youth ages 6 to 18, and that's an on-grounds residential facility. Currently, we have 36 youth in that age range living in our residential facility. Also, we have an educational program, a school on grounds for youth in the area that are unsuccessful in the public school setting. Currently, we have 10 students enrolled in that program, 1st through 8th grade. And finally, we have our transitional living program, which is for young adults ages 18 to 22 at risk of homelessness. The majority of our referrals come from people who are aging out of care at Nashua Children's Home. They would be homeless otherwise. We do take some referrals from the community as well. For our project, Nashua Children's Home is requesting funding to update our security measures that we have in place. The current cameras that we have are antiquated, operate through a local DVR on site, and not, don't perform any of the features that are used through a cloud-based system, which is what we're looking to upgrade to. In addition to the camera system across all of our 5 properties, both indoors and outdoors, funding is needed to implement new door security for up to 50 doors. This would be implemented through a fob system. NCH works with a vulnerable population of children and young adults across all 3 programs, and their safety and well-being is paramount in the work that we do every day. And I wanted to speak a little bit on our funding last year. We requested funding for this similar project last year. Part of the HUD requirements were to test for radon and mitigate any issues that arose on our properties. We did have the presence of some radon that required mitigation. So we sunk a lot of money into rectifying that. Given the nature of our work, we weren't able to wait around to see if there would be additional funding for that. We're a 24-hour operation with people in the building at all times, kids and staff. So we needed to mitigate that immediately and spent over $40,000 in doing so last year. And that's all I have, if there's any questions. Sure.
Alderman Kelly.
Oh, thank you for all the work you do, and I hear you're fairly new to the role, so welcome.
Thank you.
My first question you already took, because I was like, didn't we just talk about this last year?
We did.
So thank you for answering that,
Yes.
like midway through. Okay, so then I'll ask my other 2 standard questions, which is, do you have other sources available if we weren't to fund it, and would a partial funding be helpful?
We would rely on a full funding basis for this. If we were to get a partial funding, we would need to look at other grant opportunities, which are highly competitive and very specific to electronic grants, so we would need to do some research on that end.
I'll just comment that it looks like we will have enough for all of the facility requests if we get the allocation, but I'm gonna ask that question anyways, in case our allocation comes in differently, because it's still based on a estimate, right?
Yes, I'll give a qualified yes to that. So the circumstances that Mr. Fentross is describing, last year's application was for substantially the same thing. The discovery of radon and the nature of how that was found and how that introduced some potential liability and some real issues with the people within the building necessitated them spending a large portion of the funding that they had set aside to supplement last year's CDBG award in order to get this project accomplished. So once they had done that, and this was the impetus for setting up the radon testing and mitigation program that's now up and running, when we revisited the site after the mitigation had been installed, it didn't make economic sense really to try to push forward with a reduced scope of work for the security system. Those things, while they can be modular, you really have to kind of do them in large chunks. So at my recommendation, they agreed to just pause that project. And their funding request for this year reflects the difference in funding when added to the previous year's funding in order to get this project accomplished with a decent degree of contingency baked in because the materials and the contracting environment's much different this year than it was last year.
Thank you very much.
Alderman Timmons.
Thank you. Again, another well-worth place we have here for children here in
Thank you.
Nashville, but I want to play the devil's advocate here.
Sure.
You got dumped a substantial amount of money from the Nash Casino. And what are you going to do with that money? Could some of that funds go to this project? I'm trying to see where your money went.
Sure.
And what the city can and cannot do for you based on the money you've just gotten.
Sure. We are directing the money that we got from the Nash Casino to the implementation of new electronic medical records for Nashville Children's Home. It's a six-figure cost the first year, and then in total for 5 years, it's close to $500,000. We're one of the last facilities in the state to do paper records for all of our kids. So I made it a priority that we start implementing electronic medical records. So the majority of the funding from the Nash Casino would be directed towards that.
Follow-up?
I do have a follow-up, but
Sure.
again, is that over a 5-year period? I know what you got.
Yep.
So I'm just saying, is that over a five-year period that you're going to drop 500,000?
Yes, it is.
And
The first year is front-loaded for implementation fees and the first year cost, but over the course of the 5 years, that project is close to $500,000.
If I could ask, how did you manage to anticipate that? Because that seemed like when Nash opened up, we knew it was going to be larger than Gate City Casino. But, nonprofits typically can't just rely on success in fundraisers at that level.
Mm-hmm. We had a backup campaign to send out a appeal letter to our donors. We have a big donor base as well. It was more of a, we didn't sign that until we realized that we had the funding, but we're still in the infant processes of it, and we won't have it fully implemented until November of this year. But we're looking at different sources for that funding as well, not just on the casino.
You mentioned that you were one of the last facilities to still have paper records, but obviously medical care has gotten a lot more comprehensive and complex. And a lot of the kids that you'd be taking and working with have very complicated medical charts, medical histories, and a need to coordinate that care. So I would imagine that improving the electronic record system so that you could quickly get information, say if a patient was involuntarily admitted or had a major life safety event, would be essential to safety for that child.
It would. It's crucial, especially for our residential program. A lot of our kids come in with inadequate health care, over the course of their lives, abuse, neglect. So having an updated system that we can communicate more effectively with the state and other stakeholders is crucial.
And I remember from last year's conversation, the security cameras are kind of double-edged. Like the key fob system keeps people in the part of the building they're supposed to be in, but there was, and I don't know that it's continued at the level. Like, there was a period where there was a number of youth who eloped, and it's important to figure out where they're going, what direction they're heading, what time they left the building, and that's something where a place where effective security cameras can help in rapidly locating someone who's making a decision that could affect their life.
It's very important. We're not a high-level facility in that we don't have doors that lock from the inside out. So we do have the occasional elopement that we deal with on the residential side of things. We don't have any exterior cameras currently on our main building where the residential kids live. So with the funding that through the CDBG, we would be able to add the cameras and get a better sense of, on the rare times that does happen, to get a better sense of which direction they were heading.
I think as a project is definitely overdue. And I also think that as much as I don't agree with the approach, making organizations attend to their radon levels is valuable, because if we're trying to look out for children's safety and we don't even know that radon levels are high, then that's certainly something we would want to address immediately. I think maybe some more warning could have been given, maybe a plan for what to do would have been appreciated, but that doesn't detract from the worthiness of the project that you're trying to do. And as an organization, I don't think anybody's getting rich off of Nashua Children's Home.
Oh, no, they definitely not getting rich, but I just wanted to know, just for the record, what they did with the money, that's all. I know you're not getting rich, okay?
Thank you.
But I also know that some children do come with insurance and some don't. So not every single child that come into the children's home is on some type of assistance. I mean, the state take over, but they still get paid. So I do know that. I mean, let me just put this perfectly clear.
Sure.
There's not a nonprofit in here is getting rich off of anything. So we're going to make that perfectly clear.
That's certainly the case.
I appreciate all the nonprofits, and I know it's going to be very difficult in the next couple of years. So hats off to you.
Yeah, and I think we all understand. It
Yeah.
puts nonprofits to be in a very awkward situation to say, hey, here's a giant foam check, and we've raised all of this money for you. And that's money that we could have, as a structure and a society, actually allocated intentionally, instead of making you work for it, making you stand there for the photo ops. Everybody's grateful when a large donation happens, but one of the reasons that Nashua has an advantage over a lot of other parts of New Hampshire is because our nonprofits work together, where the infrastructure in New Hampshire is just well behind all of our neighbors when it comes to supporting the kind of work that we rely on our nonprofits to do for us.
Very true.
Any further questions? All right, thank you for your
Thank you.
presentation.
Next up is Mary Sweeney Home.
Good evening. My name's Kristen Wilson. I am the administrator of Mary Sweeney Home. For those of you who aren't familiar, we're over on 50 East Pearl Street, right across from Crosby's. We are a residence for senior, independent, low-income women from the local area. We have 31 apartments. We were founded in 1972 by Dr. Mary Sweeney, who was an anesthesiologist at a Nashua hospital. And right now, I think my ladies, their age range is from 66 to 92. My longest resident has lived in her apartment for 22 years. And our newest resident, we welcomed in March. So what we try to provide at the Mary Sweeney, and part of our mission statement, is really a vibrant community for senior women to live out their senior years. So our request is threefold. Part of it is for new locks for our apartment doors. The building is old. Over the years, we've had several keys go missing and apartment doors. The locks need to be replaced. At this point, they can't guarantee that one of the other apartments doesn't have the same lock, so we would like to replace it with a master key system. The second request is for Wi-Fi on the second, third, and fourth floors of the building. We currently have it on the first floor, obviously for the offices and such, but it would be nice if the ladies on the other floors could have Wi-Fi in their apartments without absorbing that cost themselves, because most of them cannot afford it. And the third part of our request is for a new updated PTAC unit in our community room, which we use daily. It's a room where I was in there earlier having bingo with the ladies. They have dinners in there, they watch TV in there, we use it daily. And it's just an old system that's not energy efficient, and we would like to replace that. So as far as partial funding is concerned, we are a private nonprofit, so we do not receive any other government funding. We also are not on any casino gifting, nor do we have donors. So what we would probably do in that situation is pick the project that we could feasibly do with the funds that were provided, and we would go forward with that project.
Alderman Timmons.
Oh, thank you. And thank you for the Sweeney House, because it's not very few senior facilities around, and I'm glad you're close to the senior center as well.
Yeah.
I've been in the building, of course, and I know you need a lot of upgrades because I've been there, okay? And I just want to ask, what about the elevators? Did they ever get fixed?
Our elevator works.
What about the chairlift one?
They removed the chairlifts from the stairwells. They removed them.
Okay, and one other question, I know, the bathtubs.
The ladies are required to be independent to live in the building. We are not handicap accessible. So the bathtubs remain the original bathtubs. Part of our building is the old convent from St. Patrick's.
Yeah.
That portion was from 1972. The new part of the building, which is on East Pearl Street, those are probably 10 years younger, but all of the bathtubs are the originals.
One other, shower, the showers.
So every apartment has a bathtub.
Not a shower.
Right.
Okay.
There's no shower stalls.
Yes,
They all
right.
have
I mean,
bathtubs,
the
right.
showers
Right.
inside the tub.
Right. And I've been the administrator for the past 2.5 years. I did find paperwork from years ago when they actually looked into, at the time you could like make a door in the tub kind of so that you could walk into it for people who can't lift their legs over it. Because we do have several ladies who use walkers, and they have some mobility issues, but everyone still has the original bathtub.
One other question.
You setting the
Staff.
stage for a much larger CDBG request?
Yeah.
Yes, staff.
We have 5 part-time staff because we don't want to pay benefits.
Okay.
So the Wi-Fi I could see being important, particularly given that a lot of the ability to interact with Social Security has been moved online, and then other benefit systems too. But that seems like if that were something that someone needed, is your staff, do you have case managers on staff or people that they can go to learn how to do that kind of stuff?
We do not have case managers. However, myself and the maintenance men help the ladies daily with their cell phones
Do you have any?
and laptops.
do you have
We've
any-
actually given them used laptops from the schools in Nashua when they were giving them out. We secured like 5, and some of the ladies have that. But honestly, there are some, given our age range, some of them are just not interested in learning, but we do have, it's a big range. So the younger ladies, when they want to use the Wi-Fi, they'll come down to the first floor if they don't have it in their apartments.
Well, just for your knowledge, the United Way has continued that program, so that might be a resource. Do you work with Lamprey?
We do not. Because all of our ladies are independent,
So they pick their
which
own
is why
providers?
they have to be independent to qualify to live there. So they really deal with that aspect themselves. None of us are qualified to help them with that.
So to be clear, and I think this was already stated, it's not assisted living, it's,
It is not assisted living, no.
gotcha.
Well, what we do provide, if you were to go over and ask the ladies now, they like living there because it's a community for them, and they feel like someone cares about them and is checking on them. And some of them don't have family, or their family lives far away, and living there gives them security because we are watching out, and if we haven't seen someone, we say, hey, has anybody seen Betty? And we go check on Betty.
Alderman Timmons, you got more?
I have one other
ahead,
question.
sorry.
Any empty apartments?
No, we are full, and we have a wait list.
And just one follow-up, and then I'm done with.
If you use your follow-up to make more follow-ups, though, that's how you get infinite follow-ups.
Also, the rents that's paid is what sustained Sweeney, is that correct?
Rent is based on monthly income. We take 25% for a one-bedroom. And then we still operate off of the original funds that were provided under Mary Sweeney's will. The investment from those funds are how we operate.
So I believe former Treasurer Fredette is working with you guys.
Yeah.
Have you looked at any kind of strategic development, donor cultivation, things like that?
Like I said, I've only been the administrator for 2.5 years. However, they have never looked into, raising funds through donors or any other means. This is only our 3rd year applying for CDBG, and they've been there since 1972.
So I lived next to them for a long time, and I've been alderman for about 10 years now, and I would definitely concur that I knew them as sort of like a back pocket kind of option for people when I was working at the soup kitchen that might qualify. And Mary Sweeney's always had a great reputation for being great places to live, but they have also been very much an insular community. So I have been seeing them more and more, like reaching out, connecting, and it's reassuring because it's a great program. It's a great opportunity for people to have like decent and dignified living. They can go over to Crosby's, they can go over to Cravings, they're right downtown. It's a nice way to kind of, sunset your years, but it is kind of, dangerous to do that all by yourself. So hopefully our community is stepping up to help you as you're needed.
Yeah, the ladies really enjoy the downtown area. Like you said, they're close to the senior center. Some of the ladies, parking is an issue. Some of the ladies have cars, others use the bus system. They walk a lot to CVS and Shaw's, so they make the most of it.
Alderman Senate.
Thank you, Mr. Chairman. Not exactly related to the funding, just a point of curiosity, and this is a really good opportunity for everybody to really get to know the nonprofits in our community. You had placed some emphasis on the fact that Mary Sweeney Home is not a assisted living facility, and just based on your mission and the clientele that you serve, I was wondering when that day comes when somebody who may be living there ultimately finds themselves in the need for assisted living. How are you able to facilitate that?
That is probably the most difficult part of my job because since I've been there, probably 6 of the ladies have had to move on to the next level of care. And it's always very difficult because they never want to leave, but in the end, they acknowledge that they're probably not independent anymore and they would feel safer. I try to work with the family, and I will, when we start to notice signs that they're no longer independent, whether it be dementia, mobility, those issues. I reach out to the family and I tell them, I know Medicaid is a very long process. Let's start now so that when the time does come, the funds are available to move to the next level of care. It's very difficult.
And do you have relationships or partnerships with the area facilities that they may move on to from there to
well,
sort
that's-
of maybe find the best fit for them?
That can also be difficult because a lot of the ladies can't afford a place that has a bed available. So
That's
they're
not cheap,
waiting
you know.
for some place that has the Medicaid bed. So I do my best to keep track of where our previous people have gone and whether they liked it and what the families have reported back to us about, and then give them as much information or help as I can.
It's a tough nut to crack. Thank you for your willingness to provide that service.
All good?
Oh, my question? She answered it.
She did.
You have any more questions?
I'm
So you
good.
worked really hard. Okay. All right, I think we're all set then.
Here's all
Thank you
Thank
for your
you.
presentation and your work in the community.
All right, next up is Gateways Community Services. And I know we had a few that had presentations. If you needed this and I'm not pushing the buttons, whatever, just scream at me.
Okay. Yeah, we did have a presentation, but.
There you are. And you should have the
There we
clicker
are.
up there.
Clicker's right there, Michelle.
Okay. Was it this one that you
It's
pressed?
the right button, yep.
This one, okay. Good evening. Thank you, everybody, for being here. My name is Michelle Beanie, and I am the Director of Development for Gateways Community Services.
Diane Luzzy, I'm the Director of Operations at Gateways.
So just a little anecdote, this little cutie right there, he is a participant in our Autism Center. I took that picture last year at our Family Fun Day that we have in our parking lot. But as you can see, Gateways, we've been around for over 40 years delivering services to nearly 3,000 individuals with developmental disabilities, seniors in need of care. We have an autism center that's located in our Canal Street building. We also have an adult day center in Hudson at Alvern High School where caregivers can find respite. And, you know, really, we believe that all people deserve to lead meaningful lives. And here's just a few of our programs that we have. We have early support services. We have individuals that start off in early intervention, and there's one individual he's now in his 40s, still with Gateways. So it really is from the very beginning to possibly the end as well. We have family support programs, as I mentioned, adult day, services for senior, and again, the Autism Center. And one thing, and I'm going to have Diane take it from here, but one thing that people might not know about Gateways is we do have a C2 Corp where we own 13 properties, and they're all developmental disability homes. And I'm going to have Diane step in.
So the homes that we do own, we run them as, they're 24-hour staff residents. We have folks with the intellectual disabilities. They're all for the adults. Two of the properties are the reason that we're here tonight. One is our Upstone, okay, we'll do Atherton property. It's currently, right now, unoccupied. It's outfitted for 3 individuals of intellectual disabilities. We just finished renovations there to make the bathroom accessible, so it's ready for a wheelchair. Previously, it was a walk-in tub, and it wasn't able to have somebody that was in a wheelchair reside at that home. There are staff, it's staffed 24/7, and 3 individuals, there's 3 bedrooms for them, and there's a bedroom for staff. We're looking to remodel the kitchen. It's very outdated. It's never been remodeled for the residents that are there. We would like to have the funds to make that more homey for the residents that are there. They have cooking goals. We have a lot of people that visit the home, whether it's family members, and, you know, they are always coming in and looking at the way the inside looks for their sons or daughters that are residing there. And they are, you know, have quite a few disabilities. That's why they need the 24 staff. So we're looking to have the remodel done for that kitchen. And the other property that we are looking for funds for, this is our Upstone property here in Nashua. That property is in need of some central air conditioning. We have 3 individuals with multiple disabilities that reside there. 2 are in wheelchairs. The other one uses a walker, and for their health and well-being, right now, we have some small window units. One of the bedrooms, we cannot put a window unit in. It's the way the windows are designed. So we are looking for air conditioning for that room as well, just for their, you know, their well-being. They spend a lot of time at the homes. Most of them have day programs out of the homes. So they're, you know, doing all their activities and, again, cooking in there. It gets very warm in the kitchen. There's very small windows in there. So we're looking for some central air conditioning for that property. So, and
yeah, and to answer the question about if we did not receive funding, I believe both projects will probably be put on the back burner for now until, you know, to Karen's point, the fundraising landscape out there is just unpredictable. We're closely watching the 3% cut in Medicaid and also cut to our developmental disability program. So we're just waiting to see what happens there because our other programs could be significantly impacted. So that's why we're here today in front of all of you.
Well, thank you for coming. We appreciate it. While we are interviewing you essentially to see where the city can help out with additional funds, it's also really helpful to find out about all of the different organizations that are doing things. And to that end, I would just invite anybody in the room, if you have a project or program that you want to present on, we do regularly accept presentations at other times of the year. So if you have something you think that we should know about or the community should know about, feel free to contact me or our administrative assistant, Donna. So thank you for coming with that information. I don't know if you said it because I was trying to write down and listen at the same time. I know you talked about a funding source being billable services and that insurance-based services might be somewhat questionable. What about other federal grants or programs or state support?
Currently, I'm not aware of any for these 2 particular projects, but I welcome any ideas.
Oh, I don't have any ideas.
I know. Is it okay to mention, Mike, that you were able to stop by our Atherton?
Sure.
Yep. Mike was able to visit our Atherton street home to take a look at the kitchen. So that was, I don't know if you're allowed to comment or not on that.
I think it's understood by members of the committee from other projects that remodeling a kitchen while at home might be seen as sort of like a vanity thing. For an organization that's serving people, it could mean safety features, it could mean energy
Yes.
efficiency, it could mean better utility based on updated recognition of handicap accessible resources. So, I mean, I think we understand that you're not just looking for cosmetic changes.
Correct.
And when it comes to central air, I mean, we have cooling stations around the city for when it gets super hot for that exact reason. It is a health risk, and we're aware of that as well. Any members of the committee have questions?
I do. Thank you.
Alderman Timmons. Starting. I had a 50-50 chance.
I thank you for what you do as well. But on your Upstone property, you said it's handicap accessible? Is it not? It is.
yes.
Yes.
It is, yes.
On your photo, can you, it doesn't appear that way.
I had the
That
exact
one,
same
yeah.
question.
There's, yes, so in
Well,
the
don't go in
garage.
that door.
there's
Oh,
a
it goes
ramp.
through the garage?
There's a garage, yeah.
Okay,
There's
so-
a small garage. There's a ramp.
Okay, I was looking for a ramp and I didn't see one. Okay, so, all right,
And there's also a ramp in the back, you know, there's a deck. So
Okay.
it allows access into the kitchen as well.
okay. Thank you. And it, may I follow up?
please.
And do you have someone that's ready to occupy as soon as you get the upgrades done?
So this property here, it's occupied currently with
Oh,
3
okay.
individuals. And they're all, like I said, 2 are in wheelchairs, 1 is a walker. So they're all, not very mobile. But this one here, we were looking for central air condition for them because right now they're using small window units and it gets very warm in that property.
And then there's also one window that cannot actually fit AC.
Right, and you can't see in this picture, but you cannot put the AC in where the window is around the corner. So they're looking at maybe getting a small standalone, but then it's the person that is in the biggest wheelchair. So then we're talking space-wise in his bedroom.
I guess I would reiterate your question about the first property, though, if I could.
That first property?
Yeah, the first property you said was not currently occupied.
Right, the first individual is due to move in next week.
Oh, good.
Okay.
And so that property there, it's a ranch, so it's perfect for folks in wheelchairs. However, the bathroom is not accessible for people with the wheelchairs. We have a lot of people that we provide services with. It's hard to fit them into homes because they can't use the bathroom. They're not accessible. This property is the perfect model for it. There's 4 bedrooms, so we can have 3 individuals, and then the staff, use the other bedroom. And a lot of times they have goals to cook, and it gives them to work on their goals, and it would just work better if we could have that design better, modernized.
And to almost fit the rest of the home, because the rest of the home has been
Yes,
updated.
yes.
Yes.
Yeah.
Do you modify the height of the counters so people can get to them from a wheelchair, or how does that work? I guess you can't do that with a stove.
But the plans don't have to, go ahead. He's raising his hand.
I can take this, because the client that's serving is technically a commercial facility, then the kitchen has to be designed to ADA compliance, including toe kicks and faucets and stuff like that.
So ADA compliance, is there like a manual for that? I have yet to see a large print stove, but that's just me.
Yes, there is. There's a set of guidelines that's published, and we have access to that here, and I check plans that come to us. I check that against those ADA guidelines.
Okay. Alderman Kelly, sorry.
Thank you. I didn't have this question until I asked my first question. So what will the occupants do? You're awarded the money, you're going to remodel their kitchen. Will they live within the remodel? Will you displace them for a certain amount of time while that's done?
No, we work around them. We give them advance notice that we're going to have to go in. We have to be careful with some of the vendors that go in. We may have some folks with behavioral issues, so we have to be careful with tools and things. And our property management and contractors, we're very well versed on how to get this type of work done. And if it's an individual that can't take the noise, because we have a lot of autism diagnosis, they may end up going to emergency respite while we, do some of this. It's not as critical as when the bathroom's being remodeled. That's why they had to move them into emergency respite, because there is just the one bathroom with a shower facility.
Do you follow up?
Yep.
Again, I can't find the applications on my hands. Do you have a sense of how long the renovation will take?
I believe we were quoted 6 weeks.
Okay.
Getting permits and everything.
If I could jump in. Due to the nature of CDBG, those projects would come through urban programs and be managed, frankly, by myself. And time for stuff like this is really of the essence. I think a project like that, if planned properly, could be 2 to 3 weeks for the kitchen. And the HVAC would be a matter of a day or two. One thing that I did want to bring up is that the HVAC installations that we've been doing, we're using a lot of heat pumps, and we're seeing energy reductions between 50 and 200% for the electricity usage. So you guys didn't put that in there, but I'm a huge advocate.
Yeah, that's good.
Thank you.
I presume you checked to make sure that they had a radon compliance plan?
Yes, actually, in fact, the 33 Atherton bathroom that was recently remodeled was done at their expense. When we started doing the radon testing and had our first very alarming result come in, and we recognized the situation that would put these organizations in, I began asking the individual organizations to make sure they understood the full scope of what would happen if we tested them, and Gateways declined to be tested at that time. And the last that we had discussed, they really ran out of their opportunity to wait any longer on the bathroom, so that project's actually been canceled.
Yeah, the bathroom, it was just, he just needed to be done.
Absolutely.
Yeah.
Alderman San.
I had a question about the Upstone property. Because it seems like the emphasis is on cooling in the summer. Is that facility already equipped with a functioning heating system, baseboards, forced hot water?
Yes, yes.
Okay. Does it have any of the pre-existing ductwork in the facility?
I don't know. I'm looking at it.
Sorry, I had to bring in technical questions. It seemed like you were chomping at the bit.
Mike, can you just come up?
Absolutely. Well, I'm going to wield my previous professional experience here. So, yeah, what we've been doing whenever possible is specifying a modern heat pump system, ducted heat pumps instead of mini splits. It offers better air filtration, and also the modern systems can provide heating that's electric, and still with remarkable energy savings. So in a situation like at Upstone, we would leave the existing water heating in place, whatever that be, and then just handle all the heating and cooling off a 21st century standard.
Thanks for that. And the only reason I asked is that the facility reminds me of my home in the general shape and size of it. And I know firsthand what living in a small little home like that doesn't have actual cooling in the summer is like. You had mentioned getting one of the portable units, and the little voice in my head started just screaming, "Don't!" And my leading question, I don't think it's going to be an issue in terms of the public facility ask, because that's one where we have less concern about the overlap in terms of what's being asked versus what may be available. But if it came to that and a reduced funding had to be offered, like if something like you had mentioned mini splits or something had been explored, but I know that also involves a lot of more upfront maintenance, cleaning the filters and stuff, which the occupants of the home may or may not be able to do on their own, requiring more work on your parts.
Yeah, we have a property manager, and the house is certified by the state of New Hampshire. So the heating system is checked, that has to be fully functioning yearly. So they come in and check everything, and we have to have the system, the records to show that it's been maintained.
Great. Well, thank you for all that, and thank you for what you do. I have my own experiences with Gateway with a young child. I didn't realize the full scope of the wraparound service that you provide into adulthood, but I know firsthand with the cases that you may be dealing with. You had mentioned, sensory issues, noises that, may arise during construction. Heat can be its own sensory issue, all of its own, and that can create just a day-to-day life crisis. So, hey, I really appreciate you bringing this project forward.
Thank you.
Thank you very much for your time.
Thank you.
I have one other question.
Alderman Timmons.
Oh, Gloria.
Is 33 across from that park on Atherton?
It's
Is it-
around the corner.
It's around, so they can't hear any noises from that park?
No.
Okay,
No, and they have the windows shut all the time.
okay,
'Cause they do have essentially remote.
okay. I'm facing it in my head around the corner from the park, so,
Oh, yeah. No, we don't.
okay, thank you.
All right, well, thank you for all your work, and thank you for being a great
Thank
member of the
you.
community.
Next up is the City of Nashua Economic Development.
There we go. Liz Hannum, Economic Development Director for the City of Nashua. I'm coming to talk to you about the Financial Empowerment Center, which is a brand new project. Seems like there's lots of great existing projects, so this would be a little bit different. But over the last year, we've done a lot of work to not just do real estate or business development, but also look into individual development. As Alderman Lopez mentioned, we've relied very heavily on our nonprofits to do that work in the past. And so I'm looking at ways that our Economic Development Office can help support some of those individuals, as well as take some burden off of the nonprofits in the area. So we looked at, yep, there we go. So I just gave you a little definition there of what economic mobility is. Essentially, we're looking at you can have the ability to remain in the community, afford to live here throughout your lifetime, no matter what. The Imagine Nashua Master Plan actually identified economic mobility and access to these opportunities as our #1 priority for economic development. And so this is kind of the first step in how we're going to execute some of that. Throughout our strategic planning process of economic mobility, we identified 3 different areas where we think we can, in the short term, create some interventions and really support good development within the community, both at the individual, business, and real estate levels. Just to show you, the #1 strategy for our local support or local housing needs is to increase financial literacy, and that's where the Financial Empowerment Center comes in. Establishing a Financial Empowerment Center, which is actually, it's a national model. There's 37 of them throughout the country. So we're using an existing model, and with that existing model comes grant support as well. And so this would be supplementing that grant support. We're looking at a cost of about $300,000 per year to put this on, and this would supplement to get us to that 300. And we're looking at how to build out a strategy for sustainability for that Financial Empowerment Center, because the 300 or the grant through the Cities for Financial Empowerment model only comes for that first year. So we're looking for long-term sustainability here. So here's the core model of the Financial Empowerment Center. It is no cost, one-on-one, professional financial counseling for individuals. So that means it's open to anyone within the community, but the primary user, it tends to be low income, as well as, I'll show you here, this is the financial, or Cities for Financial Empowerment demographics for all of their financial empowerment centers across the country. So we're looking at about 50% Black demographic, 35% white. The average debt reduction is about $6,000, an increase in savings in about $3,500. So we are looking at an average income of $37,000 over the course of, so because this is new, I just wanted to give you some basic demographics for what type of organization or what type of clients they're usually seeing here. So this is a government-led model. So the government, meaning the City of Nashua, is the primary user for this model, and then we would subcontract out the day-to-day counseling services to another nonprofit within the area. We did have a site visit recently, and we invited all of our local service providers, public service providers, to that meeting, and got really, really great feedback. They are really excited about this program. I think I was worried that it was, either not filling a gap or that it was something that wasn't quite needed, but based on the feedback, everyone is very excited about this. We'll find that a lot of the case managers that work at our nonprofits are having to come up with, they're seeing a lot of situations that they're not professionally trained to see. And so they're having to do a lot of work to research and to support their clients. And so we're hoping that this could actually take some of the burden off of those nonprofits as well as support our individual clients. So we're working on a location at the library, and then co-locating at the senior center, as well as being able to move around to different nonprofits, partner organizations to support their clientele. It would be a one-on-one counseling, so the only kind of criteria would be that they would have to have an individual space for privacy settings. But the idea is that we would be able to support growth, not only individual, but to kind of stop seeing some of the kind of repeat customers. We see a lot of people that are getting into housing and then coming back because they haven't budgeted well. And so this could be really supportive of that. And we can kind of partner with lots of different organizations within the community to support their clientele as well. So that's the end there. Any questions?
So in the model that you foresee, you're focusing mostly on the one-on-one counseling, it looks like, but you'd also need to kind of make this program known, launch it. Do you have any ideas for community events or activities?
Yeah, so the primary would be that we would actually get a referral system going through our partner organizations, through public service. So that's how we would start, and then build out individually through marketing programs and kind of community events, tabling at things like the block parties. So we would start with existing clientele of our partner organizations.
I was kind of thinking more of the Employment Connect event, which the Continue isn't
Yes.
presently organizing anymore. We were starting to move in that direction of, okay, it's not just about a job fair. There has to be things like financial management counseling. There has to be things like identifying strategic planning and career counseling and that kind of stuff too. So
Yeah.
I'm glad you're picking up that torch. I did it for a while, and there was that concern that would the city step in? It's a need because a lot of people live here their whole lives and want to live here and want to be part of the community. And being displaced just because you had economic vulnerability to some crisis or other is just sad.
Mm-hmm. Definitely.
Any other committee members with questions or comments? Alderman Timmons?
Thank you. Thank you for that presentation. I'm kind of a little perplexed about that whole situation. It looked like it's overreaching. It looked as if it's overlapping.
Okay.
In legacy, I don't know if it would work because you're doing duplicate work. This is what I see from that little slide. You had to do better than that than that slide because I see a lot of things that is overlapping and may not be able to work in legacy. So I don't know. That program doesn't seem to well thought out, in my opinion.
Okay, so we have met with a lot of the nonprofits in the area, and they are providing some of these services, but not one-on-one and not professionally trained. So there would be 2 financial counselors that would be full-time just doing financial counseling. So it is filling a gap that doesn't exist right now. There's a lot of organizations that are doing like class work, like workshop type things, but not the individual one-on-one counseling. The model that the Cities for Financial Empowerment Center is seeing that that's why they went for the one-on-one model versus the classroom model, because a lot of people are taking the classroom model but then not executing on that, or they don't know how to use it for their particular situation. And so that's the reason behind this model.
May I?
Sure.
And you also said about 2 hired people, professionals to do that.
Mm-hmm.
Taxpayers going to have to fit.
So the idea is that this would be grant funded. And so this would be the only city funding that we would be asking for, other than a little bit of operational funding out of the economic development budget. So for the first year, we've already secured $150,000 for this. And I think we would be hiring a nonprofit to do the work, so they wouldn't be city employees.
Follow-up?
I'm just confused on the whole project. I guess you and you have to sit down and kind of convince me this is a good idea.
Okay.
I don't really see it, but,
Okay.
you know,
I mean, she's a prototype for your future clientele, right?
yeah.
Yep.
Anybody who's struggling with their bills or their expenses, or even who's gotten so in the dynamic of having to respond to crises, doesn't see a way forward, or doesn't see that change is worth it. I know a lot of people go to those trainings with hope, and then when it's time to actually apply it, they don't know where to start. So, I mean, I can see that being valuable. My perspective being, though, the soup kitchen, I think, was way ahead of its time in having a dedicated employment advocate instead of just another case manager, because they could have had two, but they specified what people should be doing. And I think that put me in a different kind of area. It gave me a reason to do trainings and explore and become a little bit more qualified. But I agree with what your observations are, is that I see a lot of case managers and people that are there really to help with like emergency, urgent needs, and that housing stability is very important. But economic mobility it definitely overlaps with housing stability, but it goes a little bit beyond it, to the point where a person even working with someone that they really trust may not be able to continue working with them beyond a certain point, because that person now has to go back and focus back on the next crisis in line. So
Yeah.
I can definitely
And
see a niche there.
the other thing is, you have unlimited visits, so you can visit them 2 times, or you can visit them 100 times. And I think the good news is too, is like, as you kind of go through the process, even places like the Small Business Development Center have been really excited about this program, because they're seeing a lot of people that aren't bankable coming through to try to start businesses. And so this could help them be a referral location to help them improve their credit score and start saving some money so that they become bankable, and that they could actually get loans to start their own businesses as well. So it's kind of a wide variety of clientele too.
Right, and the Continuum of Care just had a presentation on a bank willing to start launching those programs. It was very enthusiastically received on Wednesday, so.
Yeah, I was really surprised at how well this was received at our community meeting with Cities for Financial Empowerment. I was kind of on the fence whether or not this would work too, but I was convinced after that meeting that this was the way forward here.
I think we've approached economic mobility in the past from a more business development perspective of, oh, you have to be an entrepreneur or a hustler or something like that, which is fine for a lot of people, and they can do it. But it seems like yours is more holistic, and it actually is a better intersection with nonprofits. And I mean, if it works, then these are taxpayers who can contribute more taxes because they have them, so. Alderman, I don't know if I use first. Kelly?
Alderwoman Kelly? So you mentioned that you had 150,000 grant already secured. Where is that from? Is there matching funds? And what do you think the expectation is that you might get that in the future?
So the 150 is from the Cities for Financial Empowerment, the group that is providing the model for us. And so they're also providing things like Salesforce, like a documentation system and a demographic collection system. And so there is no match requirement. However, based on our budgeting that we did, we are going to have to match about 1-to-1. So it's going to cost about $300,000, and they're only providing 150. And so we're looking at, we've looked at several other grants that we're going to apply to, as well as there's a kind of co-location program that most of the other organizations that do this also have, where they kind of charge a fee to be at the hospital for a week, or so that employers can actually use this as well for especially their lower income or lower level employees to provide them the service. So we're working on kind of a sponsorship development program as well to pay for it.
My only comment is I always struggle when we are putting grant money for people, because that's not always a secured thing. So what's to say in a year we'll have the money to cover those?
Yeah, so the sustainability is kind of priority number one at the moment, and so that's what we're working on. We think that we're almost ready for the first year, so we haven't stood it up yet, but that's on the priority list. But many of the funding sources that we're putting together right now and have at least a soft commitment for are long-term, multi-year kind of commitments.
Follow up?
Yep.
If this wasn't funded through us, could these potential long-term funders pick up the 40 or 50,000?
I think that they could. It would just be, it would take a lot longer to secure those. So, yes, we could do without this funding, but it would push us into a place where we might lose that 150,000. So we have about 18 months from the original date of planning support, and so that is coming up at the end of the summer. So September or so is when we have to kind of decide whether or not we're going to move forward.
Thank you.
Alderman Senate.
Thank you. I had some follow-up to Alderwoman Timmons' questions. And I didn't want to put on my budget hat tonight, but we're in the middle of a budget season.
Yeah.
I'm looking at the funding information and the breakdown here. I understand the ask here is for 50,000. Help me understand which portion of this is contemplated in your proposed budget this year.
My operational budget?
Yes.
So that would be 25,000 of the 300.
Mm-hmm.
So the 50 would just be from CDBG. And I could do less. It just means I have to secure more additional funding through that sponsorship kind of development. But 25 in my operational budget going forward.
Right.
Yeah.
Follow?
Yep.
And the total activity budget of 300,000 is that like a first year model?
So that is every year, essentially. It would be 300.
Okay.
So based on the model that the Cities for Financial Empowerment Center require in order to move this forward under their model, you are required to have 2 full-time staff and a manager for them. That would be staff of the nonprofit. So essentially, we'd be in charge of kind of working with the nonprofit to secure all of that funding, and then they would manage the day-to-day operational cost.
I see. All right. So I do share some of my colleague at large's concerns. I mean, you hit the nail on the head when you said, whether it's 25,000 or 150,000, there are taxpayers who are going to raise eyebrows at this, especially when we consider that it's an ongoing thing. And, we're saying we're going to hire nonprofits to provide a lot of this service. Well, they won't be city employees, but we're still going to have to pay them. And I do just struggle with this, where there's a lot of, I guess I would say, future uncertainty. I think the project itself, the presentation that you gave, I think that's a very valid cause, because Lord knows that's something I could have used when I first struck out on my own at 19. I was useless with money and I had none of it. That being said, we do have to give the full consideration of this, and it is just a little hard for me to look at this in a vacuum of, well, we're just looking at a year's worth, and then we're going to have to come back here and figure out how we're going to fund year 2 versus something like, a kitchen upgrade or some HVAC installations, and
Right.
And that's not to necessarily say that this doesn't hold up to that. It's just a I don't know, I guess I have more questions than I have answers right now, if that
Yeah,
makes sense.
it's always easier to fund one-time expenses than ongoing.
Sure.
So I understand that. I do think that it is coming, the 25,000 would be coming out of my operational budget, but that is actually, my operational budget was reduced this year, and so it's within the existing budget already. It's not an additional cost. So I think that the taxpayer issue, they're not seeing an additional cost coming out of economic development for this than what my existing budget is.
Can I just ask one more follow-up?
Sure.
Assuming we funded this and it goes well, but then, you know, a consideration that we're already making for this year occurs next year and CDBG gets wiped out, or it gets reduced down to a shell of what it is, and we have the same number of folks before us asking, presumably to continue funding this, then we have to do kind of turn inward. Is that correct?
Yes, or we spend the next year finding additional sources of funding for this. So I did not intend for this committee to fund multi-years. I am anticipating it being self-sustaining going forward. It's just this stand-up year that I'm looking at support for.
All right, thank you.
Alderman Timmons, you got more?
I just have a statement. This appeared to be a good program, okay? But I just see too many red flags.
Okay.
And that's concerning to me. And so I would like more information on it.
Okay.
And I need to see it in my simple brain, how it would work. Just right now, I just can't see it because
Okay.
I see other things. And somebody have to get me there to see it.
Yeah.
I'm
Okay.
just not seeing it right now.
All right.
It's just a statement.
I mean, I'm happy to sit with you if you'd like, just to understand it, even if it doesn't get funded through CDBG. We're going to try to make this work long-term. It just will take longer, and we may have to find even additional funds that wouldn't be available through that Cities for Financial Empowerment Center. But so I'm happy to talk it through.
Okay, thank you.
Well, I appreciate the Office of Economic Development looking at this. Like I said, I think in my opinion, my experience, traditionally the city has more looked at business development level, larger groups of people, attracting new investors, trying to build up, amenities, that kind of stuff. And I think there's a lot of potential starting with the people here rather than bringing businesses here. And I think building on the strengths of the individuals in the community, particularly aiming at a population that is much more motivated and open to change because of the experiences that they've had, I think could really benefit our community. I know just a few years ago, we kept saying, well, how do we get more vouchers for people who are unsheltered, or how do we get more vouchers for people who are low income? And we ended up oversaturating ourselves with vouchers because we didn't have anywhere for them to go. I think making sure we have that pipeline, where I have no doubt Director Bagley is going to be presenting on upcoming issues with unsheltered people and how we're trying to intervene on the crisis level. There needs to be further steps for them to take. And I know from firsthand experience and pretty well documented through history that helping people find jobs and helping people improve those jobs next, and then, expand their housing, improve their means and their assets, moves them farther and farther away from crisis, so that we're not seeing the same faces every year and the same families every year trapped in positions. So I can see it. I definitely think, as was pointed out, it would be a good idea to work on the presentation or marketing so others can. Thank you for bringing it.
Yeah. Good.
Any further questions?
Thank you.
Okay.
Next up is City Public Health Department.
Good evening, and thank you for, oops, I better leave that there because she's tall, huh? Good evening,
sit down if you want.
thank you.
I mean, you're city staff.
We're good.
Okay.
Yeah, we're good. Thank you for accepting our application for this project. As you are aware, the City of Nashua has seen an increase over the past few years of the number of individuals that need additional support during the winter time. And so this project is designed to address that need for that vulnerable population to protect them from the hazards of the extreme weather. We've had experience for the past 2 years providing this service, and last year, actually, our Division of Public Health and Community Services actually ran the warming station. We're going to continue this again next year, and it will operate the same time from 7 p.m. to 7 a.m., 7 days a week, from December 1st through April 15th. And if there are days, as we saw last year, when there's additional time where we have to extend the days, we plan to do that when there are no other options for this population. I'm going to have Latanya Musioli, who is our Housing Services Officer, speak to the community benefit of this, and not just share the numbers of individuals that we were able to provide services to as guests at the warming station, but then also some of the other efforts and work that we did along with this, so you'll understand why this project is important for funding through this funding source.
Thank you. So to start, just to give you guys a scope of the amount of individuals we served, in January, we had 72 unique guests to the warming station. February, we saw an increase up to 92 unique guests. March, we had 87, and in April, we finished with 91 unique guests. So we did have quite the attendance. On average, we had about 25 to 30 or so people per night utilizing our services. So our request is for supplies and for 20 weeks of staffing. Of importance to note, in addition to preventing loss of life due to winter weather elements, we really wanted to connect folks with service providers as well. So some of our community health workers from the Division of Public Health worked at the warming station and also received referrals for individuals that needed assistance with housing navigation and connections to other services, potentially needed assistance with applying for benefits. And we often find folks that need assistance with obtaining vital documents such as an ID, birth certificate, divorce decree, really any of those things that can confirm who the individual is to apply for services in housing. On a couple of mornings in April, as we were winding down for our closure, we did connect with community partners to come on site to facilitate some warm handoffs to services. So we did work closely with the Nashua Soup Kitchen and Shelter. They provided us with meals during those extended hours so that folks didn't have to worry about missing breakfast by staying to connect with service providers. The Soup Kitchen and Shelter also provided their outreach staff to come over on one of the mornings to connect with folks as well. We also connected folks with Greater Nashua Mental Health's PATH outreach worker who came during one of the extended mornings, as well as Harbor Care's community health worker and supportive services staff that were able to get folks connected to dental services, housing navigation, healthcare supports, and substance use treatment and recovery resources. We also were using opioid abatement funds to fund the operations of the warming station. So we had recovery resources present and available for folks as well. And we know that keeping folks indoors can often serve as a deterrent for using substances because living outside unsheltered can lead folks down that path. So we were able to do that as well. And I believe, and Director Bagley can, correct me if this number is inaccurate, but we reversed at least 1 to 2 overdoses on site with staff available. So we did train all of our staff in Narcan training and CPR as well. Also of importance to note, we partnered with St. Joseph's Mobile Clinic, and they supported us for 2 months. So in the month of March, they did see 15 guests at the warming station to help support with healthcare needs. Again, we have some folks who may not have health insurance and might not be seeing a provider regularly, so it was really a great opportunity to meet folks where they're at, to meet their needs and help support them. Something also of importance to note, as Joanne had mentioned earlier, entering into our homeless management information system. So this warming station gave us the opportunity to make contact with individuals living unsheltered that we were not aware of, and that were not connected to any other service organizations. So we were able to enter those individuals into the homeless management information system and coordinated entry for prioritization for housing vouchers.
So this project is in addition to other organizations that are providing support over the winter, and so this serves as an overflow. So once those other facilities like our National Soup Kitchen and Shelter that will do an extended warming station, once they get to maximum, and once the Mission or Hope Center gets to max, this is a place where you have an additional opportunity for people to come in, receive respite, and then also get connected to services. And as it was already stated by Pam, in Nashua, our organizations do a really good job of working together and connecting folks. And when you know where folks are, because there's a central locality where they are, you can provide those services. So we're able to, over that 12-hour period, get to learn a little bit more about the situations and circumstances of the folks that are there to help then get them connected to other resources as well. So that's our project, and we're hoping that the funding that we've asked to support this will allow for us to continue to do this work. We were able to get some donations from churches and other places, and hopefully, if this funding from the CDBG is not available, hopefully that will be available. But as we're also learning with all of the how do we say, uncertainty around funding and availability of resources and support, we need to do as much as we can to help support each other and continue these services so that we can continue to have the impact of saving lives. I mean, our job at the health department is to protect, promote, and preserve lives, and this is the way that we do it through this particular service, in addition to other things that we offer.
All right, I think I saw Alderman Kelly up first. Alderman
Great,
Kelly?
two questions.
Alderman Kelly, am I using your address correctly? Alderwoman or Alderman?
Alderwoman.
Okay, sorry for getting it wrong. Alderwoman.
Thank you. Two questions. So question one is, I know that we identified a location this year. I assume we're using the same location next year. Are we thinking about where we're going to use after that?
Yes.
Who you opened the can of worms?
Fine. I'm not gonna, all right. My second question is, I know that your budget has a reduction in the amount of health workers you would have. You mentioned this as being an opportunity to staff. Would you be bringing on additional staff or covering with your reduced staff numbers
So the way that we supported the warming station this past year was we actually hired what we call gig workers. These are individuals who come from the community, have lived experience, work at other organizations doing the same type of work. Those are the folks that actually were the essential staff for the warming station. And then the community health workers were sort of like the backup staff, because the community health workers have more training and the resources, making the connections, that can do the follow-up. The warming station support staff are there for between that 7 to 7 time period to provide that safety and then help provide information to our community health workers. And so this funding that we're asking for is to help support some of those gig workers.
Follow up, please.
Yep.
Do you feel confident with your reduction in health care and community health workers that you'll have that backfill?
Yes.
Great. Thank you.
Bless you.
Thank you, sorry. Alderman Sennett?
Thank you.
Bless you.
No, you may-
Bless you. The staffing portion of this that's contemplated in the ask here, is that amount adequate to cover the staff that you anticipate bringing on, that per diem staff, for the entire term that the warming station is open?
It's for 20 weeks, so yes.
Okay, and that would be 20 weeks
Two staff
times the
members.
amount that you anticipate bringing on to supplement your community health staff and volunteers and so forth.
Correct, yes.
Okay.
20 weeks starting when?
December 1st.
Okay.
We would
And-
like to start December 1st.
It was a common refrain, we would like to be addressing this earlier, and you are trying to do that, so I appreciate it.
Yes, no, thank you for taking my next point, Alderman Lopez. It makes me happy to see that we're discussing this on May 12th, geez, the first real nice day of the year, right?
Some of us hate it.
I can hear your face hurting, just like mine. Alderwoman Kelly had broached the topic. I'm just going to go one step further. Elm Street is secured for next winter.
Yes.
None of the progress that's taking place right now and the discussions will hinder that.
No.
Okay, that's all I've got.
Alderman Timmons.
Thank you, Chairman Lopez. Well, I had the opportunity to at least be at the Warman Center to see exactly what was going on. And your guest was unique, and it was beautiful, and they do need the support. It was well stocked, thanks to volunteers that, like myself, that gave you money to buy sugar and all the other kind of stuff, coffee. The key is that the staff there was well-trained. The video that or the training that we went through was necessary. Not all of us can stomach that because I have a low constitution, and that's why I couldn't do the whole thing. I'd rather get the funds versus staying there. But it's necessary, and there's a lot of volunteers that's really, it is out there helping the health department because they do have the constitution to stay with our guest that was at the Warman Center, who was very unique in themselves. It took a lot of work, and you think you're there and they'll go to sleep and you'll be okay for the rest of the night, but that's not the case. They're up the entire time, needing whatever they need to do, go to the bathroom, want coffee, want whatever they want. So it was telling, and one of the things you did say is that there was a guy, I think that's what turned me off, is because I couldn't do anything for him. And if I can't help a person, I'm pretty sad. And there was a person there that had a toothache. And he had, and it was bad. And I called, I actually called you in the middle of the night, you didn't answer. But the point I was trying to make is that I wanted to know if we could have somebody there that was emergency. He tried to pull out his own tooth, and he was on drugs. And it just hurt me a lot. So that was the reason why I couldn't do it, because I could not help him. I just wanted to take him in my car and say, we're going to an emergency. And I know that was a no-no. So all the work that you guys did during that 20 weeks was phenomenal. Phenomenal. If you didn't work there one day, just one day you will see the magnitude that went into that service. It's not just them getting warm, it's all the other services that you provided. And it's a lot. And so thank you a lot for that. I just wish I can have that constitution to do that and not freak out and say, everybody come home with me. I'll make sure that you are sleeping and that you have a warm bed. And I know I don't have the capability of doing that either. But that's one of the reasons why I rather donate versus just violating the rules and say, you know what, get in my car. I don't care what they say. I'm going to take you to the hospital. I'm going to give you all the money I got. That's how I felt, because I like helping people, and I felt that I could not help them enough, and you guys have. Thank you.
Well, thank you. And we appreciate any amount of time that any of our volunteers spend with us doing that work.
Just going to plug that Director Bagley was doing her full-time director role here and covered more than a few shifts, got up more than a few times really early to make sure that that person that was in need got to the next step. So I appreciate you going above and beyond, as well as everyone else who's working with community health and the staff. I certainly appreciate the staff and the health workers and all the things that everybody's doing, but directors can kind of ride over it all, and if they don't, and if they actually get in there, then I think it speaks highly of the person, so I appreciate that. I did want to ask, just to step right onto the awkward part. This will be an awake overnight warming station that we're planning?
When you say awake,
Will people be able to sleep in beds horizontally?
we still do not plan to have beds, but we do plan to have better seating accommodations.
Okay. It is my opinion, and I've said it publicly, that individuals who are pushing for a specific model, especially if they represent organizations or purport to represent a number of organizations, should really step forward, because the number of people that we're looking at as the final, I think you said an additional resource to all the work being done in the community, it's about the capacity you would need to operate another emergency shelter, and the city really, really needs one. When I was managing Maple Street, on average, we had 35 sleeping residential 30-day residents, and then during this time of year, we had an extra 30 overflow spaces. And when that program went down, there really wasn't anything to take over for it. And all of the nonprofit organizations that are operating, one is actually presented here, are not only operating at their full capacity, but they've been expanding it over the last couple of years. And I think some of the people who step forward and say that they have a mission to help people and to reach out need to look at how to really do that, because looking at programs that, take an enormous amount of work and enormous amount of personal sacrifice to run, and saying, well, you have to do more, isn't as responsible as stepping up and actually doing it. I think everything that we saw, I also volunteered at the warming station, suggests that the first best thing we can do is be there for people and not turn away. As much as it's difficult to say, okay, well, I can't help this person more than I'm helping them right now, it's crucial that we do that part and that we do that referral and connecting part when we're able to. I think the Public Health Department is doing a very good job of that. I think we're trying to throw back as many starfish as we can, but this is a crisis, and I don't know where we would have been if you hadn't, and your team hadn't stepped forward to move this instead of just saying, well, I can't do everything, so I'm not going to do anything. So I appreciate it.
Thank you.
Great job.
Any additional questions? Oh, I guess I have one. Is the city eligible for charitable gaming? Or do we need like a partner in this?
We're not.
Fine. It would be nice to actually be able to address some of these needs without having to draw directly on taxpayers. Okay. And you had mentioned that if you got partial funding, you would obviously continue to seek the full scope of the program that was needed?
Yes.
Is there a way that any members of the public or organizations that might be interested might be able to engage in that? Are there any strategic planning meetings or summits or anything? Is there an
Yes,
annual?
so there's a couple of things that we do plan, and going back and evaluating, our implementation of this warming station. There were quite a few ideas of how to get additional resources from our Alderwoman Timmons and from some of the other volunteers that were there. So we are looking forward to adding some of those components to this as well.
Could one of them be a doorbell?
A what?
Could one of them just be a doorbell?
Someone did ask for a doorbell. There are pros and cons to a doorbell.
I know, there's definitely someone who's going to ding on it all night. Okay, well, I appreciate all the work that you do.
Thank you, and we appreciate your support.
All right, that looks like the last presentation.
Director Sullivan has his hand up.
Director Sullivan?
Mr. Chair, I know that Jane Goodman is with us this evening from the Soup Kitchen. We had inadvertently left her off the presentation list. I wonder if the committee might entertain a brief presentation from the kitchen and the executive director.
Director Goodman can come up and present for as long as she needs to.
With 2 minutes being the maximum.
No, as much as she needs. Nobody puts a soup kitchen in the corner.
I'll just glare at him from over here.
Right.
I swear
Take the
I
time you need. There's
RSVP'd
no,
twice.
we're here for it.
After all, you're the anchor.
So, hello, everybody. Thanks for waiting it out. And thanks for just giving me a few minutes. I am going to just spin our revised mission past you because it really speaks to this project, and that's to provide food and shelter with dignity to individuals and families in need while promoting a path to independence through direct services and partnerships. And you heard it all here tonight about all the partnerships. And that speaks loud and clear, everything from the warming station to our Friends at Family Promise to our partnership with Lamprey Healthcare. I mean, everyone works so hard together to accomplish a lot for the most vulnerable in our city. I'm asking for something, I guess it's kind of boring compared to some of these things. We're in our 44th year of operation. We're in our 10th year, over 10 years, at our 2 Quincy Street location, and we're showing a lot of wear and tear. We spent the last year upgrading, and we did get new freezer doors and refrigerator doors, and those are really heavy, and it was a big deal. We just got a great new paint job from Leadership Greater Nashua. One of the members of the cohort is also here. And so, I mean, that's just amazing, trying to make every penny work. We got new tables. And so then we get back to our floors and our dining room, which we have just found to be completely unhygienic. We cannot get them clean. And then we've also noticed since the installation, they are warping and they're just becoming unsafe. So it's kind of just not really exciting. It's a facilities upgrade we're looking for. It would be exciting for us, of course. But we have about 300 people that come through our facilities every day. That's for breakfast, and that's for dinner, and then also for our food pantry. And then also our outreach clients that are coming through every day. So it's a very high-trafficked area, coming through to take showers, to do laundry, to use their bathrooms. Okay, I'm over my 2 minutes. So we'd love to replace our floors with a more hygienic product and have a little bit better installation done. I'm going to answer your question ahead of time. If there were partial funding, it would be pretty difficult given the year we're heading into. And so we might want to table that and apply again, but we really would hope to get this done. It's not that I even look forward to doing a flooring project because you have to close the whole place down for like at least a week, and it's very difficult. But I think for long-term durability of the building, it would be really beneficial. Thanks.
It's killing me that, like, I was there when it was being all put together, and now we have to renovate it. But I mean, 10 years in soup kitchen years is 1,000 years. People are constantly moving in and out. The building gets no rest.
That's true.
Can I ask what the current floor is made out of?
It's a rolled linoleum, but it's embossed, so it's just basically trapping dirt.
Oops.
Right? Is that what you call it, Mike? It's an embossed linoleum.
Yes.
Has the ever-present specter of radon been explored?
Yes.
Yes. In fact, right now, they're going to be the first active recipient of the radon testing and mitigation program on the mitigation side. So that's in process right now.
That is reassuring since I worked in the basement for about 5 years, so.
Our levels were very low, just over the limit, but we're fixing it, and it's going to be an easier fix than most.
Safe. It will be safe.
Yes.
Alderwoman Kelly.
I do have a question for Ms. Goodman, but since we brought up radon, I noticed that there was zeroed out around the radon and mitigation testing line in the allocation.
Yes, there's the allocation that was in the substantial amendment is intended to carry some of that stuff over. Really, it's the range that we're looking at to spend per facility can go from about $3,500 to say $3,000 up to a high already, as we've seen at $40,000. So due to the nature, the repeat nature of many of the people that apply for grants right here, we envision this eventually tapering off to almost nothing. So the remaining funds from this current allocation, we're expecting to carry us through this round of facilities, pretty cleanly.
Great, that's what I wanted to hear. Appreciate it.
Oh, looking at me. I always consider the soup kitchen the anchor of everything in Nashua, so I have no questions.
Oh, how exciting.
It's
Well, thank you.
straightforward. It's a soup kitchen
Yeah,
and shelter.
Soup kitchen, I mean, I've been here 35 years, and I remember when it was over on
Chestnut.
what's the name of the street? I'm thinking.
Yeah, Chestnut.
Chestnut Street, yeah, to the left, Chestnut, and it wasn't even, it was really a little dingy hole at the time, and I used to help over there when I first got here. It was my first encounter with the soup kitchen after I got out of the military. So it's been around and grown and looked really fantastic. I remember moving to Lock Street and then over to the now soup kitchen, so I've been following you anyway, and following the directors anyway. So, thank you.
No,
That's all I
thank
have
you.
to say.
Well, I think it was, the original site was originally a barber shop. I do not miss running up and down stairs. But the site that you have now was generously provided by the American Legion, I believe?
It's a VA, yep.
The VA, sorry.
Well, we bought it, the building, so,
I think Alderwoman Kelly had.
VFW.
yeah.
I'm fine, I'll talk about it next Monday.
Alderman Kelly?
I'm good.
Anyway, I was just going to say, it was provided by the VFW. It wasn't ground built up as a soup kitchen or to provide the kind of services that it does. I know a lot of work went into planning and conceiving it into the form that it is, but everything is unanticipated. And I think the second you hit the level of like, oh, good, we finally quadrupled the size of the kitchen, it was full. How's that energy project going? Is the solar panel still?
The solar panels are still there. Yeah.
Sun's still in the sky?
It reduces our bills a little
At least
bit.
that's one windfall, is that the utility costs are hopefully not the biggest problem. Maybe it's a demonstration that making sure you invest in care in a facility means that it'll serve the city for more years to come.
Yep. We did just purchase a new energy efficient dishwasher. That was another part of our renovation.
Oh. I loved accidentally
As a
opening
little
that and flooding
side.
the whole universe.
We want to go.
Is it still the top-loading one?
Yes, Tom. it is.
Okay.
I mean,
I may or
Alderman
may not have been
Lopez.
told not to use that anymore. Well, anyway, you guys do great work, and I think the need is definitely recognized. So I think we're going to review all of these in the next session, right?
That's correct. We'll have a scoring meeting Monday next week at 5:30 PM here in the Aldermanic Chamber. That's correct.
Thank you.
Now Alderwoman Kelly does have a question.
Alderman
Well,
Kelly.
I feel
Alderman
like I
Kelly.
was told not to speak, but it's okay. I just wanted to make it known that I think that the soup kitchen does incredible work, but I am on the board of directors, so I'll abstain from the discussion around that. It is not because I don't think they do incredible works.
That's fair. You trust them to stand on their own merits.
They do a great job with it.
Mr. Clerk, do we have any unfinished business?
We
Actually,
do.
before I move on, I should ask, are there any further comments from Mr., sorry, I'm trying to blank on your name already,
Junger.
Junger, and Director Sullivan?
Thank you. No other comments.
Okay,
All set. Thank you.
all right. Any further, any unfinished business?
There is none.
Any new business?
There are none.
Any new business ordinances?
There's also none.
Table in committee?
There is none.
Anyone wishing to make public comment? You may approach the microphone, give your name, address.
Not all at once.
No fighting for that spot. Remarks by Alderman. Any comments to be made?
Do we
Alderman
not have
Senate?
general discussion?
Oh, I'm sorry.
It's not on there, but
Yeah.
we can.
We can do it if Alderman Kelly, Alderwoman Kelly. yes.
I just wanted to make sure that this in full crew will be with us on Monday, so that if we have questions, it sounds like our new urban programs manager has some depth of knowledge around the program, so I just want to make sure that this whole lovely crew will be joining us.
We'll do a short straw drawing to see who has to, no, we're all expecting to be here.
Great. That was my
How
question.
would you even draw a straw? You have to use
I
the
don't even
thinnest
know. I've always
pencil?
wondered that myself, actually.
That's a good question.
Alderman Senate?
Oh, thank you, Mr. Chairman. I just wanted to, on behalf of our colleague Alderman Thibodeau, convey his apologies. He messaged me during the meeting to let me know that, like all of us, he is human and mixed up his schedules for the week. I couldn't possibly blame him because I'm here every night this week, so.
Yeah, I just show up, and if I don't have a meeting, I
Same.
don't.
But he sends his apologies and his regards.
Okay, thank you. Alderman Kelly?
I just want to belabor the meeting as much as possible
Yes.
with a ridiculous thing, because I'm a word person. When you said elope, I was like, what, they left to get married? Apparently, there's a third definition of that where you are leaving a facility. with other people in a secret way. So just so you know, there's a third definition of elope.
Good to know, good to know. It's almost Lopez, but not quite there. Any questions, any comments from?
No, I just want to say that, our nonprofits are special, and we need to do everything humanly possible to make sure they get as much as they can from us. So that's the only thing I have to say. I believe him, I know.
Okay, so presuming we are in the remarks section, and there's full agreement there, I'm just going to plug the Tree Streets Block Party on June 14th. Any nonprofits wishing to participate, you can rent a table, engage the community, bring a little activity for the community to do, whether it's a raffle or face painting or bubble blowing, some kind of fun activity. It's a great event. Alderman Senate.
I'll also plug a event that isn't necessarily nonprofit driven, but certainly is in the spirit of volunteerism and community. On Saturday, May 17th, Dr. Crisp Elementary will be holding a Clean Up Dr. Crisp Day to tidy up the facilities in anticipation of the summer vacation.
Nice. That's a great idea. All right. Any Alderwoman Kelly?
I was going to move to adjourn, unless you had
If
more
you'd
things.
so move, please. Any objection? All in favor, say aye.
Aye.
Opposed? All right, we are adjourned.
Great job. Thanks, guys.